Hi, this is Chris Preve from Chris Preve Hypnosis. Hypnosis is such a powerful tool, but even though it's a very powerful tool, you do need to be aware of contraindicators in the hypnosis process. Now, contraindications are red flags that should or will pop up before you begin your session. Now, if you're not specifically trained to deal with some of these contraindicators, your best off is just to refer them out. I know when you're starting out, you want to kind of bring in anybody in that you can, but it's in your best interest, and most importantly, in your client's best interest and their safety, if any of these come up, to refer them out, or at the very least, get a note from their GP so that their doctor knows that they're working with a hypnotist, just so that we're completely transparent and we are working with the medical professionals. Now, some of the examples of contraindications are schizophrenia, pathological personalities, alcohol or drug psychosis, senility, epilepsy or narcolepsy, bipolar disorder, and clinical depressives. Those are all indicators that really should raise the red flags. Also, some serious heart conditions may also be considered contraindications. It doesn't mean that hypnosis won't work with them, but what it does is it means that they need to raise a red flag. And again, get a note from the GP or from their doctor stating that they are aware that they're going to be working with a hypnotist. Now, the reason for that, once again, is for your client's safety. If there are any things that will interfere with the treatment plan that their doctor has for them, the doctor needs to be aware of it, and you need to be aware of it as a hypnotist. Once again, if you're not specifically trained in this, your best thing to do is to refer it out. Once again, contraindicators in a hypnosis session. If you see any of these or if they come up, you should raise a red flag, have a different conversation with the client, and potentially get a GP or a doctor's note. Once again, schizophrenia, pathological personalities, alcohol or drug psychosis, senility, epilepsy or narcolepsy, bipolar conditions, clinical depressives, and sometimes serious heart conditions can be considered contraindicators. I also want to make sure that I ask my clients, are you at risk of hurting yourself or someone else? We do have a duty to report here, and first things first is our client's safety. I'm Chris Preve from Chris Preve Hypnosis, and those are some of the contraindicators that we need to keep an eye out for.